Welcome back to Talk of the Town on 99.7, 1450 WHTC and WHTC.com.
And we welcome you back to Talk of the Town for this Monday, June 8th. I'm Gary Stevens. We'll be back to open line following the 11 o'clock news, but on the second Monday of the month, we are joined on a regular basis by the second-term Republican House Representative from Casco Township, representing Allegan County in the State House, Mary Whiteford. She joins us via a Zoom connection. Mary, good morning and welcome back to Talk of the Town.
Good morning, Gary. Good morning, everybody.
And hopefully we won't have the landscapers at work.
No landscapers here today.
Yay, yay.
They usually aren't on Mondays, so that was a surprise last month.
Yeah, we were a little, well, then again, we were catching up because of stay home, stay safe, or safer at home and some of the restrictions. We'll talk about that in a few moments. If you have a question for State Representative Whiteford, now you can't join the Zoom connection, but you can call us on the phone at 395-1450, 395-1450. Most elected figures have been asked about their opinions considering what has happened in the wake of the George Floyd death and race relations in communities across the country. Instead of maybe asking the general question, what are your thoughts about it? I'm going to pose it this way, Mary. Do you get a feeling that maybe we needed something like this to be able to have the discussion about race relations that frankly has been maybe long overdue?
You know, that's where it's more challenging. I have a brother-in-law who's a police chief out in Illinois. He has 2 black daughters who he adopted. He doesn't care what color somebody looks like. I know many police officers in Michigan here, when they were kids, they wanted to grow up and help their communities. I think that we have one really, really bad situation that has now labeled so many of our hardworking police officers who do care about their communities. And I find it's a very, very sad time for me because I believe all lives matter. I believe most police officers are doing their best to help their community. And right now, many are being labeled opposite. But it's been wonderful, some of these marches. There was a huge march in South Haven on Saturday, and there were many police officers who joined and saying, you know what, we're in this together. We need to make sure it doesn't matter what color you are. You need to protect the rights of everybody. You need to not abuse others. But you know, in any field, any profession, any community, there's going to be a bad person. And it's shameful that if that behavior had been hidden and protected and let that behavior continue to get to this point, that's unacceptable. So just like everything, it's complicated, but every person needs to feel like they're safe in their community.
Now, the thing is, the state Senate has passed legislation last week. It was drafted before the George Floyd incident by a Ann Arbor Democrat, and it was passed, I believe, unanimously, that it's going to be sent to the House about dealing with the training for police officers in Michigan, some reforms that are needed. Your thoughts about what might be coming down the pike that you and other House members are going to have to deal with maybe as early as this week?
Well, I do understand that by statute, we can take away the ability of organizations to develop their own policies. Currently, MCOLS is the group of police officers who establish the training standards for all police officers across the state. I believe that the best way to do that is through MCOLS and make sure that that's part of the training. But if you find that a group will not take on that, then it is the responsibility of the state to put it into statute. So I think it's brought up a very important conversation. Should the police officers be having that as part of their standards? Just like CPAs set up their own standards, nurses set up standards, and then the state intervenes sometimes. What is the role of the state? And I do believe if the governing body over police officers is not stepping up and having that as an important part of their training, then yes, the state should do it. So I'm looking to hear what MCOLS and the Police Officer Association has to say about that at first, before I come to a final decision about what I'll support and not support.
395-1450, 395-1450. If you have a question for State Representative Mary Whiteford, who represents Allegan County in the State House. Today is June the 8th. I don't want to make too much of that in the sense of what this discussion has been a little bit earlier about, but yet for restaurants, for diners statewide, they can now enjoy food for the first time across the state. Retailers had been open since Tuesday. We're seeing a relaxing of stay home, stay safe, or safer at home. And it's welcome, but it comes also with the caveat that the dial could be turned back up if the COVID-19 cases go back up. Mary, this is going to be a little dicey over the next couple of weeks, I'm afraid.
Yeah, so this has been going on since about March. St. Patrick's Day was my last day that we're in session. We went into the safe stay at home order the next day. Okay, so this is where it gets complicated. We did all our testing. At one point, it was about 50% of all tests were positive because it was such a small amount. And then there was a presumption that once we had massive amounts of testing, that percentage would stay high, that the number of people who are sick and dying stayed high. Well, what happened is we shrunk it down to 5%. So even though we're testing over 13,000 people per day sometimes, that the number of positive cases are way down. It's totally flat and decreasing. It has been for a month. And I think that's a really important thing to know. It's important to protect lives. And now it's time to also protect livelihoods. We have one of the highest unemployment rates in the country. It's been a grand experiment. Every state has taken their role differently. Every governor and executive has done this differently. And where do we compare under the most restrictive rules in the entire Midwest, perhaps the country, versus states that didn't? And, nobody has a crystal ball. Nobody has hindsight. You say hindsight is 20/20. But now that we're using our ability to look back and see what other states are doing and how things were handled differently, there's really no difference. And honestly, I have over 450 families in Allegan County that I'm trying to help them get unemployment insurance. I have over 150 families that have been waiting over 8 weeks without any help at all. So feel blessed, everybody. If you're at home and you've got an income, you're able to look out for your family. But there are a lot of people in our neighborhoods who are still truly struggling because of this. So like everything, I'm going to say it over and over, it's complicated. But the way that we're moving forward, I don't think that there's going to be a huge surge. I think that we're coming up with ways to keep safe. People, still a lot of people wear masks. People wear masks in their cars. I mean, you have that right to make that decision. And I mean, I even have some friends, my kids' friends, who tested positive because they had a visit from a family member in Illinois. The one had 103 fever for a couple days, and then her spouse tested positive, had no symptoms at all. I personally, as a nurse going through nursing school and having my bachelor's degree, I really doubted the fact that somebody can be completely asymptomatic and test positive, and it still kind of blows my mind. But now I have somebody I personally know who tested positive who's on quarantine now. So it's sad. I'm worried about people's livelihoods in the meantime. And you know what? It's a massive, massive budget impact now because people haven't been working. People haven't been spending money. I'm on the verge of making massive cuts to healthcare. We have 2.4 million people on Medicaid in our state, about a quarter of our population. That is expected to go up to 3 million people. Nobody realizes, but to be able to put in our state match, that will cost us $500 million of general fund. General fund comes from sales taxes and business taxes and payroll taxes. It's not easy. I mean, we have got to figure out a way to help people work and provide for their families.
Question is then, can it be done without help from Washington, or do we need to get some help from Washington to be able to make the ends meet for at least fiscal 2020, the rest of this year, and looking at the fiscal 2021.
Yes, we need help. We got over $3 billion, and it's set aside right now. There's a Senate bill that I think we're voting on this week, that puts in some of the spending of that federal money, working with the governor's office. We're still going to have $2 billion set aside. And right now we're in the works to try to get the ability to use that to make up for our shortfalls, because it's directly related to the virus. If we can do that, that will be saving lives, because especially in my budget with Health and Human Services, this is a safety net for our state. And it just breaks my heart if I'm going to have to make cuts for foster families, for Medicaid beneficiaries, for senior citizens, for food services. I'm going to have to make cuts in all those things, all the safety net, because we are at the shortfall. So we need to work on getting things back functioning again. And we need to have that help from Washington and to be able to have that flexibility to use some of those funds.
395-1450. Good morning. You're on the line with State Representative Mary Whiteford.
Good morning. Last night I heard a woman on the radio who, I guess she was a former undersecretary of HUD. So she has some credibility, and she's kind of an international economist. And she was saying that, and it was kind of a conspiracy, that there's a move, and it affects this state with so many people out of work, so many businesses closed, their revenues will not be coming in, and it will cause the state to go to Washington begging because the state can't print money, and Washington will have more control and be doling out the money and the control that goes with that.
Your thoughts on that? Thank you very much for the call.
Yeah, so kind of goes along with what I was saying before, is we were shut down. Businesses and small families were unable to work, and that we needed assistance from the feds. We have gotten that to the tune of almost, $3.8 billion coming to the state to help us during this time. Are we begging? No. Are we asking to consider different things? One of the things that the feds did consider was the amount of matching funds that we put in for Medicaid. So they decreased that responsibility that we have as a state for 2 quarters. That is actually ends up being about $500 million. So if we can get some assistance and not have to have that large amount of matching funds to go in for our Medicaid beneficiaries, that would be a huge help. And that's something else I'm advocating for. So I would say we're not begging, but we're asking for consideration on flexibility to do these things as a state.
395. Yeah, 395-1450, 395-1450 if you have a question for State Representative Mary Whiteford. Let me pose you this question that was sort of brought up a little bit when our conversations last month with U.S. House Representative Bill Heisinger, saying, hey, I'm not going to consider any more money for the state until they get that money, for nearly $4 billion allocated out. And he sort of put the blame on the Whitmer administration, but to a certain extent, you're saying that money has to be doled out, not just by the Whitmer administration, but by the legislature as well?
The way that we put in our bill before we left on March 17th was that the governor had flexibility to spend federal money. So the governor and the executive have had that flexibility. When we had an appropriations committee hearing 2 weeks ago, I did feel angst that they had planned on spending the money in so many different ways without working as a partnership. But then they held back on doing that spending, whether it's to work as a partnership with the legislature, which would be ideal, so to bring different voices to it and have a transparent process. It seems like they are working on that. There's not a lot. I know there's ongoing conversations with the budget director and the appropriations chairs in the House and the Senate, and knowing at least $50 million of general fund money needs to be worked on together. But I'm feeling optimistic about this, where I wasn't 2 weeks ago. I feel like that we may be in a place where we can work together and then work on getting that federal match and try to make up this deficit without causing harm to the people of Michigan. But I do know Congressman Heisinger, we had a conversation. This is very challenging, and this is something that I do disagree with, is that all of the departments were asked to furlough employees. So out of a 2-week period, many of those employees have to take 1 day off a week. That is saving the state over $60 million over these few, I think it's over 2 months. These employees can get federal unemployment benefits because it goes down to the fraction of time that they're not in work, but they're also getting $600 a week of the federal COVID money. And they were put to the very front of the list for unemployment benefits. Well, I have a big problem with that. I think that's not using, because federal COVID money, that's still taxpayer money. I don't think that that's right, and that's a conversation we had with Congressman Heisinger, especially because, I said I have over 150 people who have been waiting for benefits over 8 weeks, over 450, and that's just in Allegan County. This is similar across the state. So I don't agree with that part of it, but I agree with working together and seeing what we can do to get help with using that federal funds to make up these deficits that we're facing.
Good morning. You're on the line with State Representative Mary Whiteford.
Oh, good morning, Mr. Stevens. Good morning, Mary. You've done a wonderful job for people in Allegan County and our state. I don't know if you're aware of what's called the Niagara Reef that goes from Ingham County west through Allegan County. There's billions of barrels of oil. They should encourage people to develop the oil resources. They do that in North Dakota, and they pay for their public services. But I learned about that in 1976 from the Miller brothers. They were oil development company in Allegan, Michigan. But you should look into that. Maybe take a trip to North Dakota to see how they fund the public needs and so forth. Anyway, thank you.
Thank you. Appreciate the call. 395-1450. I don't know whether or not there's enough oil to be able to pull something like that off here.
No, but I appreciate him bringing up that thought.
Yeah.
Thank you.
395-1450 if you have a question for State Representative Mary Whiteford. We'll take this to the top of the hour, by the way, our conversation here. There's not much time left, unfortunately, budget-wise, not just for fiscal 2020, but fiscal 2021 as well. This COVID-19 situation has really thrown a monkey wrench over a lot of things, and, some tough decisions have to be made, and, let's put it this way, the governor is not the only one that has to make some tough decisions, even though she said, I got to make some tough decisions about the COVID-19 situation. There's more tough decisions to be made by the legislature as well.
Yeah, we do. And I've got a budget team there's 8 of us just on my budget because it's almost half the state budget. And we're trying to be ready for every scenario. We've poured through the budget, dozens and dozens of hours of Zoom calls, just trying to make sure that we're ready for every scenario. And that's really for the 2021 budget year. I'm just hoping and praying everybody can get back to normal, back to providing for their families safely. There's a whole new understanding of vaccines and the spread of infections, and we've become complacent as a society on how important it is to wash our hands. And I can't say everybody because there's always people who are super, super thorough, but it's a new world right now, and the understanding of what's going on. A little extra fear among families, but also knowing the role of keeping our families safe, keeping our grandmas and grandpas safe.
395-1450, 395-1450. I'm going to throw it open to you for a final moment or so. We've talked about the race relations situation. We've talked about the budget situation and the COVID-19 situation. Is there anything flying under the radar, shall we say, Mary, that, let's put this on a good note. Anything good that is that could possibly be coming out of Lansing that lawmakers are working on?
Yeah, so I'm going to Lansing tomorrow. I am going to chair my Health and Human Services Subcommittee, and we're going to talk about 2 different things in that committee. The one thing is nursing homes. They've had major pressure on them because it came out that at least 1/4 to 1/3 of all COVID deaths were in nursing homes. And there's been a lot of learning and a lot of blame and pointing fingers, and I don't like to do that. I like to move forward and say, what are you going to do to keep your patients safe? And so they were really glad to come in and they're going to testify tomorrow on that. There's also something else called health homes for mental health issues and opiate issues, where somebody has a one-stop shop to help with their care, with their addictions. We've had pilots around the state, and I'm pushing for an expansion of that. Integration at the service level is what we call it. So we're going to have a hearing on that tomorrow. And then I also have a bill up in Health Policy Committee tomorrow, and that's a freestanding crisis intervention unit. So it's licensing for that. So instead of going to the ER, instead of a police officer taking somebody in jail who's having a mental health breakdown crisis or suicidal, or they've lost all track of reality, that they can go to one of these freestanding units and get the care from the moment that they walk in. They can stay there for 72 hours as it's determined whether they need long-term admission or if they can go home at that point. So we won't have people sitting for days in Holland Hospital or any other hospital waiting for care. And so we'll have that licensing structure and set up these regional hubs around the state. And really, I think that's a really positive thing. And I think it'll really help a lot of our families.
With that, we'll button up our conversation with State Representative Mary Whiteford. We'll put a link to her state page on our website at WHTC.com. We put the audio on this conversation in a few minutes, and then we'll have the video as well, a link to it a little bit later on today on WHTC.com. Mary, as always, thank you very much. Hopefully we can chat in person next month. If not, we'll do this Zoom thing again. It seems to work out pretty well. We appreciate your time. Thank you, Mary.
Absolutely. Thank you, Gary. Thank you, everybody. Have a blessed day.
Thank you very much. That's State Representative Mary Whiteford on WHTC's Talk of the Town. Coming up, it is CBS News with Steve Kathan, followed by WHTC News with Peg McNichol. Then we'll finish up our WHTC Talk of the Town program, some open line time. And yes, I will talk about, well, negativity and dementia. There is a tie-in to that. That and more coming up after the top of the hour.